Thanks, Kate, and thanks everyone for joining us again this Friday afternoon. Today, we'll talk a little bit about our COVID-19 trends, what they mean for King County's phase placement, and we'll talk about our vaccination efforts and where we may be headed. As of yesterday, there were 98,095 confirmed cases, 5,827 hospitalizations, and 1,525 confirmed deaths since the beginning of the COVID-19 pandemic in King County. This week's forecast is for stormy weather continuing, but there are reasons for optimism about the long-range forecast. After 6 weeks or so of increasing counts, the number of new cases this week remains stable compared to last week, with an average of 350 to 360 cases a day, which is more than double the level that we were seeing in early March. Our 14-day incidence rate has been rising since that time as well, and is approximately 241 per 100,000, which is slightly higher than last week, and again, about double what it was at the end of the fall-winter surge in early March. Since early March, incidence rates have been trending up for all age groups, except for age 65 and older, with the highest rates in 18 to 24-year-olds, followed by 25 to 49 and 5 to 17-year-olds. And over the past week, the rising incidence has slowed in these groups. The stabilizing case numbers and incidence rates are a hopeful sign, although it's too soon to know if this indicates that we're at a turning point in the current surge. For example, a worrisome sign is that test positivity has been on an increasing trend, and we're estimating that the percent positivity is close to 6% now, which is about 3 times what it was in early March. And this indicates a substantial number of cases are not being tested and identified. Overall, COVID-19 incidence remains highest in the cities in South and Southeast King County, including Auburn, Kent, Federal Way, Burien, Renton, Tukwila, SeaTac, Southeast County with Covington, Enumclaw, involved West Seattle, South Seattle, Delridge, and Highline. And this week, we've also seen an increase in Bellevue compared to the week prior. Now, these areas continue to experience double to triple the number of cases and hospitalizations compared with Central and North Seattle, Shoreline, the East Side, and Vashon Island. All of these data and the trends are available on our COVID-19 daily dashboard summary on our webpage, and you just check the tab that says Geography over time to get the recent trends in the different communities. As far as hospitalizations go, they've also been increasing since mid-March, and our rate is currently 5.8 per 100,000 per week, approximately 3 times what it was in early March. Over the last 7 days, 135 King County residents were hospitalized with COVID-19, which means 1 person is hospitalized every 1 hour and 14 minutes in King County. And that's similar to the number from the prior week. Hospitalization rates are increasing in younger adults, while decreasing in older adults who are protected through vaccination. Yet the risk of hospitalization remains higher for older than younger adults. And while adults 40 to 69 years of age accounted for the most hospitalizations, again, over the past week, twice as many young adults, 20 to 39, were hospitalized compared to people over 70. The increasing number of cases and hospitalizations among young adults reinforces that COVID-19 can cause severe disease in people of all ages, and there's still a lot we don't know about the disease and its long-term health impacts, even for people who do not require hospitalization. Our weekly deaths remain comparatively low compared with our fall and winter surge. We have 1 King County resident who dies every day in King County. This has been stable over the past 4 to 6 weeks, and that's compared to 9 deaths per day during the winter peak. With protection of our older adults through vaccination, the proportion of deaths in younger age groups is increasing. For example, over the past 28 days, 8% of deaths have been in the 35 to 49-year-old age group, compared with 2% overall during the outbreak. And 28% of deaths have been in the 50 to 64-year-old age group over the past 28 days, compared with 13% over the outbreak as a whole. On the other hand, the proportion of deaths among adults 65 and older has fallen from 85% overall to 61% in the last 28 days. Now, as many of you know, the state will evaluate King County's phased placement on Tuesday, May the 4th. And based on the metrics outlined in the roadmap to recovery, our current case and hospitalization rates indicate we'll be rolled back to phase 2. Our 14-day new case rate is 242 per 100,000, and the metric for phase 3 calls for that number to be below 200. And that's calculated with a 7-day lag as per Washington State Department of Health. And our 7-day new hospitalization rate is 5.8 per 100,000. And that metric calls for that number to be below 5 for phase 3, and that's calculated with a 10-day lag. Now, with respect to variants of concern, the state continues to sequence an increasing number. About 12% of positive test samples are sequenced last month. And most of the COVID-19 in Washington State is now variants of concern. The virus that's out there, that's circulating, that we're passing around from one to another are these new variants that are more contagious, some of which are quite likely to cause more severe disease as well. So as more variants are found in the state, we continue to find more variants of concern in King County. B.1.1.7 has been increasing and is now the most prevalent variant identified statewide. And our P1 is also increasing recently. And these more infectious viruses are making it more difficult for us to bring this outbreak under control. So to summarize the epidemiology, King County entered phase 3 with the rest of Washington State on March 22nd, at a time when cases and hospitalizations were rising. Since that time, our case numbers have continued to increase, and we've increased by 80% since that date. The hospitalization rate has also doubled since that time. So our surge has continued to grow despite the precautions we're currently taking as a community. Now, have no doubt, our situation would be much, much worse if we did not have incredibly effective vaccines protecting our older adults. Unfortunately, at the moment, we don't have enough younger and middle-aged adults vaccinated to counteract the impact of variants that spread more easily. And we've seen increasing numbers of people infected and hospitalized. Now, because vaccines take a few weeks to be fully effective after the second dose of a 2-dose vaccine or the first dose of the J&J vaccine, limiting activities and doing things more safely is the fastest way to turn the current surge around while we continue to vaccinate. So to protect yourself and those around you, limit activities with unvaccinated people from outside your home. Avoid crowded indoor spaces. Pay attention to improving ventilation in workplaces, businesses, and homes, including by opening doors and windows, and please wear a well-made, snug-fitting face mask. COVID-19 spreads primarily through the air during close contact with infected people, often from people who don't appear to be ill or before they develop symptoms. At times, the virus can also build up in indoor air and infect people further away. Everyone should pay attention to improving ventilation, and we have great new guidance for business owners and building operators on strategies to improve indoor air quality that is available on our website, and you can also find it with a link on our Public Health Insider blog. Now let me transition to speak about vaccine for a few minutes. It's great news for all of us that so many people have been vaccinated. And as we further increase the number of people vaccinated, and as disease rates come down, we should be able to do progressively more and more without restrictions. It's a simple fact that right now and in the future, if you're vaccinated, you can do more things safely. And that's the best way out of this mess of a pandemic for everyone. There are now 1.75 million King County residents aged 16 and older who have received at least one dose of vaccine. That's almost 2/3. It's 64% of residents with one or more doses, and 42% are fully vaccinated. Among older adults, our coverage rates are fantastic. 91% of residents 65 and older have received at least one dose, and that's compared with 82% in the US. And 81% of our adults 65 and older have completed the series, and that's compared with 68% across the US. A recent real-world effectiveness study released by CDC found a 94% reduction in hospitalization for full vaccination and a 64% reduction for partial vaccination in adults 65 and older, showing how important and effective vaccination is. Now, despite this accomplishment, 36% of adults in King County are not yet vaccinated, and that's too many. We need to continue to improve on that in order to reach a higher level of community protection that will allow us to return more quickly to more normalcy. Now, with respect to race and ethnicity, we've done very well closing the vaccine equity gap in our older adults. For those 65 and older across all race and ethnicity groups, we have 80% or higher coverage with one or more doses. But when we look at everyone 16 or older, our one or more dose coverage rates are 60 to 67% for white, Asian, Native Hawaiian, Pacific Islander, and Native American residents, compared to 42 to 43% for Black, African American, and Hispanic residents. So to help address these disparities, we're continuing to hold regular community vaccine events to reach traditionally underserved populations and engaging with community partners to bring vaccine in accessible and acceptable formats to our communities. We're also continuing to do a lot of work with our mobile vaccination teams to reach vulnerable populations. We have 19 mobile vax teams in the field. They've vaccinated over 500 people during in-home vaccination visits for homebound people and their caretakers. We've held vaccination clinics at 124 homeless service sites and held vaccination events at 96 affordable senior living facilities. Now, vaccine supply and demand is changing. Our vaccine supply has increased and people are able to sign up for appointments right away now with no wait lists. Many people have already chosen to be vaccinated because of age or underlying conditions or because they value the protection from vaccine. And we encourage everyone who has not been able to find an appointment in the past to try again now because it's much easier and it's much quicker. We're making vaccination as accessible as possible by opening up vaccine access without appointments and expanding more evening and weekend hours. And we're about 2 weeks into our eligibility for younger people age 16 and older. And we know it will take some time to reach all who need or want to be vaccinated in this younger age group. And we know there can be barriers to those who want to be vaccinated, including work schedules. We also know that some people who have waited to be vaccinated have done so for a reason, and we'll continue to work to ensure that our community has the information they need to make the best decisions for their health and the health of those around them. We'll continue to work with community members and organizations, workplaces, and other partners to help people understand the tremendous benefits of vaccination, both individually and for our community, and to address concerns and make vaccine as convenient and as accessible as possible. You can find vaccination sites throughout King County at kingcounty.gov/vaccine. Our vaccination sites at the Kent Showwear Center and the Auburn Outlet Mall are now open for appointments for all King County residents age 16 and older, regardless of zip code. In addition, at Kent and Auburn, walk-in vaccination with no appointment needed is now available Monday through Saturday, 9 a.m. to 4 p.m. There are 1,000 walk-in vaccinations available at each location daily. And at these sites, you can choose between receiving an mRNA Pfizer Moderna vaccine or a J&J vaccine, one and done. We're also working to add more evening and weekend appointments because we understand people may have a tough time getting vaccinated during the week. Saturday is a great day to get vaccinated at our Kent or Auburn sites. This Saturday, May the 1st, we have lots of openings at our vaccine clinic at the Auburn Collection Outlet Mall. You can also make an appointment on our website if you desire, kingcounty.gov/COVID/registration. You can also just walk in without an appointment between 9 and 4. We also had a previously announced clinic on Sunday, May the 2nd at Auburn, and this one has been canceled due to low registration. So please use the clinic that's available at the Auburn Collection Outlet Mall for Saturday if you would like to get vaccinated this weekend, and I encourage you to do that. Our City of Seattle vaccination sites, all 4 are open to all King County residents, not just residents of the City of Seattle. Lumen Field, North Seattle College, Rainier Beach, and West Seattle. And you can visit www.seattle.gov/vaccine, or you can call the Customer Service Bureau at 206-684-2489. to be vaccinated at one of the City of Seattle sites. So with that, I'll pause and I welcome a discussion with you.
Great, thank you so much. For members of the media, please use the raise your hand function in Zoom if you'd like to ask a question. And first question is from Jessamine McIntyre.
Hello, and thank you both. Thank you to Kate and Dr. Duchin for today. Just considering where the numbers are right now when it comes to King County, is there anything that can be done between now and Monday to change the projection of the rollback? And when it comes to the mass vaccination sites, we know there are great efforts to not waste a dose. We know there's redistribution as well when it comes to those unused. Can you tell us more about where those are going and how they are being distributed?
Yeah, Jessamine, thank you. You have a very impressive record of being the first question. I look forward to that. So
Always will be.
good job. I think the issue with the phases is determined by the governor, and the dates on which those metrics are calculated are in the past. It's already happened. It's a done deal. So I would, as much as I would love to go back in time and change things in a way that would decrease the number of COVID-19 cases and hospitalizations that occurred in King County, I just can't do that. We have to live with the consequences of our actions. And as you know, I've been kind of warning, or at least raising awareness about the direction that we've been heading in now for many weeks, and the steps that we would have to take as a community to avoid exceeding the thresholds. And I acknowledge it's difficult, but we haven't been able to do that. And we have exceeded the thresholds. Now, that doesn't mean we can't do it. We can do it. I know we can do it because we've done it previously. And so with a little extra effort and with a lot more vaccination, I'm confident that we're going to be in a better place. But I can't undo what we've already done. With respect to Pfizer doses from our clinic yesterday, where we had extra doses at one of our sites, we were able to transfer those doses to the University of Washington, who were able to use them. And what we're seeing now, as vaccine supply and demand are coming into more of an equilibrium. Some places, some days we have more supply than we have demand. That will lead to extra doses. And the challenge is that in order to make vaccine most available and as easy as possible to get, we have to have it ready when people walk in, because we're doing walk-in now. We're offering lots of just, you feel like getting vaccinated? Great, we've got it. Come on in, you're out in 15 minutes or 30 minutes. In order to do that, you have to have the vaccine ready when someone shows up. And so that means out of the fridge, stored at room temperature. And once that happens, it has to be used within a certain time frame. We absolutely don't want to waste vaccine doses because they're life-saving and they're going to get us back to our lifestyle. So we want to make sure that if a clinic thaws a number of doses so that they can be prepared for walk-in appointments or walk-in patients who don't have appointments, then those doses can be used, if possible, in another location. So what our team is working on now, new procedures and protocols to allow rapid identification of where excess doses exist and rapid redistribution of those doses to people where there's demand. It's challenging, it's labor intensive, but it's worth the time and effort.
Great, thank you. Next question comes from Steve McCarran.
Thanks very much, and thanks for taking the question, Doctor. Ultimately, I know it's going to be the state's decision next week, but based on what you have said, do you think it's inevitable that the county will be moving back next week? Second question I have for you is I wanted to get your thoughts on the news, I think, that came out yesterday regarding New York City. Basically, the mayor setting a date saying July 1st, we're going to open everything up. I know that's 2 months away, but could we see a similar situation here, and what needs to be done to get to that point? Yeah,
okay. So with respect to the inevitability of us moving back King County into phase 2, nothing's ever over until it's over. I mean, based on what we know, on everything we know today about what the thresholds are and the dates on which they were calculated, we would predict that we will be moved back to phase 2. If things can change between now and Tuesday that I can't predict, but I don't have any reason to think that we will not move back to phase 2 based on the level of COVID-19 transmission, hospitalizations, and cases in our community over the past weeks. Now, we can turn that around as quickly as we like by restricting our activities, limiting our activities, taking care with making sure we wear face masks inside or when around others who are unvaccinated, avoiding crowded indoor air spaces, improving ventilation, doing all the things that we know work. That will help us drive those case rates down as low as possible. As we vaccinate more people, the risk for us having further surges decreases. This is the great thing about vaccination. It's a long-term pathway out of this outbreak. It's our ticket to freedom. The more people vaccinated, the less risk there will be that we will have a rebound in our outbreak. Now, the more people that are unvaccinated, the higher the risk is, inversely. So in order for us to be in a place to open up completely over the summertime, we will need to use good COVID-19 prevention strategies to suppress the transmission as low as possible and get as many people as vaccinated as possible over the next few months. And if that goes well, I am very confident that we could be very close to our pre-COVID lifestyle over the summertime. But that, there are some key assumptions here that we continue to vaccinate large numbers of people who are unvaccinated and that we continue to take the necessary precautions. I also want to mention something about, well, I'll talk about this later, but let me leave it at that for now.
Thank you. Next question is from Eilish O'Neill.
Thanks for taking our questions. Mine is kind of two parts. The first is, what do you think is going on with all the open appointments at mass vaccination sites? Is it that people are, that mass vaccination sites are difficult for people for whatever reason, that they're far away or seem inconvenient or impersonal or don't have convenient hours or whatever else? And depending on your answer to part one of this question, is how is King County approaching that, the kind of the strategy around vaccination given the open appointments at mass vaccination sites?
Yeah, those are questions that are at the top of our minds right now. So, initially in the last few months, as vaccine became available, the groups that had access to them were people at highest risk for severe health outcomes and our healthcare workers, and then people at risk based on age or working as essential workers or so on. And many of those people took advantage of the opportunity and became vaccinated. The folks who remain unvaccinated, there are reasons for that. And I think there's just some softening in demand overall. It's not something that's limited to mass vac sites, although those, have their own unique pros and cons, and some people they work well for and others they don't. But we've seen across the community where vaccine is being offered that there's less demand regardless of the venue at the moment. We are working very hard to try and help people understand the value of vaccination, both individually and to the community as a whole, the safety and effectiveness of vaccination, and how vaccination really is the way that we are going to get back to our pre-COVID lifestyle as a community. Now, how do we make that happen? This is the challenge, right? We need to understand what the issues are that are causing people to delay. Some of it may be convenience, making the vaccine more accessible. difficulty because someone's working or has other responsibilities and getting to clinics with fixed hours. Some people don't like the hassle of the online sign up, so hence we've gone to offering walk-in clinics. Some people may have just gotten discouraged with the whole process, and I don't blame them because it was such a frustrating ordeal to try and find a site. Some people may have just given up for now, but can again seek vaccine and get it quickly and easily at this point. And then there are those who have reasons for delaying related to their understanding of how well the vaccine works, or health risk related to the vaccine, its safety, or other questions that we can help answer. And so our focus will be on working with community groups and with the public to understand how we can address all those different barriers, whether they be related to access or whether they be related to someone's understanding of how important it is to get vaccinated or the risk of vaccination, and try and provide the best information possible that will allow more of us, as many of us as possible, to take advantage of this life-saving and lifestyle-saving vaccines that will allow us not only to reduce the number of us that get sick, the number of our family members and friends who get sick, but also the disruptive outbreaks that occur throughout the community, and this constant rebounding up and down with the need for restrictions. I mean, that is something that we can eliminate with adequate vaccination coverage. So trying to help people understand how important it is. Even if you perceive yourself at low risk, you can still be a transmitter, a spreader of vaccine that can result in serious outcomes for others. That's where we're going to focus now. And we know, that there are lots of different audiences who have different concerns, different issues based on age, based on race, ethnicity, and personal beliefs. And we're going to do our best to try and work with everyone to help them make the best possible decision for themselves or in their community.
Great. Next, we have a written-in question from reporter Lily at the Bellevue College Watchdog. She asks if you anticipate we'll see an increase in interest in vaccination among younger people following a phase 2 rollback.
Well, I hope we see increasing interest in vaccination among younger people. I understand, because younger people are at relatively lower risk for hospitalization and particularly at lower risk for death, why they might not feel as motivated to be vaccinated as someone who is older and is at a higher risk of getting hospitalized or dying. And I think that that's perfectly natural way to think about things. On the other hand, there's also community to think about. The vaccines are very safe, and they provide not only a benefit to the person who's vaccinated, but to everyone that person comes in contact with. So I do hope that our younger people will understand that there are many reasons to be vaccinated beyond personal health. It does provide a tremendous personal health benefit, but it's true that benefit is greater for older people and people who have underlying health conditions. But we also, we're part of a community, and we're dependent on one another for the health and safety of our community in so many ways. And I think that when people understand how interconnected we are through the ability to spread an infectious disease unknowingly, unwittingly, to someone who will suffer and in a way that will make our lives, collective lives, more difficult, I think many people will be vaccinated. But it's just not clear to me that folks really have thought it through in that way.
Thank you. Last question is from Evan Bush.
Hi, Jeff. Thanks so much for the time. Mayor Durkin sent out a news release last Friday saying that Seattle could reach community immunity in just a few weeks, using 70% of residents and workers in Seattle as that benchmark. And I'm wondering what your perspective would be on that, if that's realistic. And then a second question, thinking more big picture, as you're looking over the next several months and into fall, what variables or factors, such as variants, seasonality, mobility, vaccine uptake, do you see as most important to determining our collective path with this virus?
Okay, those are two substantial questions, Evan. Thank you. So community immunity. If we get to 70% coverage, we have 70% coverage. We have 70% community immunity. That's a substantial level of protection. The higher level of protection we have, the less disease we will have, and the more likely it is we'll be able to re-engage in our pre-COVID lifestyles. However, that is not a herd immunity threshold, and I think that's where people are getting confused. Herd immunity really means that the disease can't transmit effectively from person to person in the population because there's so many people either immune from natural infection or vaccination that the virus continually runs into dead ends. So it basically, each infected person cannot spread to more than one infected person like they do now, but less, and then it just peters out. Now, currently, most experts think that we need 80% or higher population coverage, and possibly as high as 90% because of the increased transmissibility of the new variants to reach true herd immunity. But we don't have to reach herd immunity to reach a level of community protection that will allow us to get back to our pre-COVID lifestyles, perhaps with some precautions like improving ventilation and making sure we have good air quality in buildings and taking more precautions, just to avoid close face-to-face contact as much as possible. And in certain situations, high risk, possibly even wearing face masks, but not anywhere near what we're doing now. So we don't have to reach herd immunity to get back to a good pre-COVID similar, to get back to a good lifestyle that is similar to what we had pre-COVID. So 70% is a laudable and important population immunization target. It should not be thought of as the end game. We really, if possible, would want everyone vaccinated. We know that's not possible, but we would love to be well above 70%. The higher the vaccination coverage, the lower our risk for having rebound outbreaks. And over time, and this gets into your second part of your question, Evan, we'll find out the duration of protection from vaccination. So that will be one factor that will determine how things go in the future. And then how this virus evolves, whether or not there are new variants that evade protection from the vaccine, which would require, again, revaccinating people. So that's another reason why this true herd immunity concept is challenging, because you may have to provide boosters to folks over time, or even a reformulated vaccine similar to what we do for flu vaccine. We don't have any indication that that's necessary at the moment, but I'm thinking this is a potential future scenario. So revaccination and how successful that will be. And then, of course, the issue with children, it's impossible really, I think, to conceive of getting 90% of the population vaccinated when 20% are children, and we don't have a vaccine license for children right now. So having vaccines come online for children will further help us suppress transmission in the future. So I think the key things going forward are duration of protection from the vaccines, how the virus evolves over time with respect to its ability to evade vaccine protection, if that happens or not, and to what degree, and then how well we do revaccinating people, if that's necessary in the future, how successful we are. I think there have been way too many premature pronouncements that COVID vaccine pandemic is on its way to obscurity. I think that it's very difficult to predict the future with a new emerging and evolving infection. Now, we're definitely moving in a great direction. Our vaccines are wonderful, and they're going to get us back to a really great place, very close to pre-COVID. And I would hope, it's quite possible that we'll get this pandemic under control for the long term. But I can't say I have a high level of certainty that we can predict exactly what the future holds with respect to how this virus will evolve and how well our countermeasures will work over many, many years. The other, of course, big unknown is human behavior. And, we really do need to understand how this virus transmits and continue to take precautions because not everyone, can be protected through vaccination. And finally, the global situation, Evan, is another big question mark that is incredibly important for us. We live in a small world, and if COVID-19 is uncontrolled anywhere, new variants can emerge and can threaten us locally. So we have a very strong interest as a country in making sure that there is vaccine supply, robust, available, high quality everywhere in the world, and high vaccination coverages everywhere in the world, because this virus is so highly infectious. It will transmit very readily, as we've seen it has done so far, from one country to another. It crosses borders at will. And as new variants develop elsewhere in the world, because there are not enough vaccinated people and transmission, high rates of transmission, and unvaccinated people are what breed new variants. Another reason to think about getting vaccinated even locally, to suppress the evolution of the new variants and provide fewer opportunities for new viruses to evolve. So there are both local, national, and international, factors that I think ultimately will determine the course of the outbreak for us here in King County in Washington State.
Thank you. That's it for questions. Any final remarks from you, Dr. Duchin?
Well, as always, I so much appreciate all of your joining me and our team to help us communicate to the public about this terrible pandemic and how to get out of it. And I think it's clear now that our best path out of this painful cycle of COVID-19 resurgences and restrictions, and for a return to normalcy as quickly as possible, is by rolling up our sleeves and getting vaccinated. Getting vaccinated is important for ensuring not only our own health, but for the health of our family members, friends, coworkers, and others we come in contact with. With COVID-19, we depend on one another for community protection, including for highly vulnerable people who might not respond to vaccination because they're immunocompromised, with a weakened immune system from disease, from treatment, or from medications. We all know people like this, whether we realize it or not. There are tens of thousands or more immunocompromised people in King County alone. The more people that are vaccinated, the less COVID-19 will circulate and the safer we will all be. I'm confident that with increasing vaccination coverage in the near future, we'll see a sustained decrease in COVID-19 cases, hospitalizations, and deaths, and fewer large outbreaks that are so disruptive in our workplaces and other settings where people gather throughout the community. With increasing vaccination, we'll also be able to bid good riddance to the difficult restrictions that were once our only option for control of COVID-19 before we had highly effective vaccines. So the bottom line is simple. How successful we will ultimately be as a community and how quickly we will get back to normal life depends on how many of us get vaccinated and how quickly. And as I mentioned to Evan, to be truly successful, we'll need ongoing high levels of vaccination coverage, not only in King County, Washington State, and the US, but throughout the entire world. So with that, I thank you again. I hope you have a wonderful weekend, and I look forward to chatting with you next Friday.